CEN Test Prep Exam July 2018 Results. Question 1. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from Option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss. The correct answer is option B, esophageal varices. Question 2. The antidote for benzodiazepine overdose is Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option B, flumazenol. Question 3. The antidote for acetaminophen overdose is Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenol. Option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A positive Koenig's sign is suggestive of Option A, a cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Question 5. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 6. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Question 7. The priority patient for a trauma team activation based on mechanism of injury is Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Question 8. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Meningitis is an inflammation of the Option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 10. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Question 11. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 12. The most common cause of acute renal failure in hospitalized patients is Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 13. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 14. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Question 15. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mmHg and in the left arm is 130/80 mmHg. The chest X-ray shows a widened mediastinum. The nurse suspects option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. Question 16. Le-Fort fractures are classifications of fractures of the option A, mandible. Option B, mid-face and maxilla. Option C, orbit. Option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 17. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A, left anterior descending artery. Option B, left circumflex artery. Option C, right coronary artery. Option D, left main coronary artery. The correct answer is option C, right coronary artery. Question 18. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 20. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 21. Carbon monoxide poisoning leads to hypoxia primarily by option A, causing bronchospasm. Option B, binding to hemoglobin with higher affinity than oxygen. Option C, destroying lung parenchyma. Option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Question 22. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 23. The most common cause of airway obstruction in an unconscious patient is option A, laryngospasm, option B, foreign body aspiration, option C, the tongue, option D, mucosal edema. The correct answer is option C, the tongue. Question 24. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is option A, diltiazem, option B, verapamil, option C, metoprolol, option D, digoxin. The correct answer is option D, digoxin. Question 25. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours, option B, 4-6 hours, option C, 2-3 days, option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours.